Hello. This is my presentation on refugees and PTSD. Um, this presentation will talk about contextual information and cultural considerations for treating refugees with PTSD. So let's start off talking about who is a refugee. A refugee is someone who's been forced to flee their country, forcibly displaced because of persecution, war, or violence. These individuals fear persecution based on race, religion, nationality, political opinion, or membership within a social group. Refugees can often, refugees often can't or are afraid to return home, so they're forced to flee and have no option of returning. Further causes of displacement include war, ethnic, tribal, or religious violence. We see that 120 million refugees were forcibly displaced worldwide as a result of persecution, conflict, violence, or human rights presently. Another statistic, 73% of all refugees belong to the same five countries. So we see an influx of refugees coming from Afghanistan, Syria, Venezuela, Ukraine, and Sudan. Um, Hold on. This is important to consider within clinical considerations of really understanding that population that you're treating if you're treating um, an individual or several individuals from that culture and understanding the cultures that they come from. Um, Prevalence of PTSD. So this is about the prevalence of PTSD and depression. Refugees and affected individuals, such as veterans, um, have a 15% to 30% prevalence of PTSD and depression, whereas the general population, non-refugee populations, we see 3.5% prevalence of PTSD. Trauma exposure. So, to discuss why there is heightened levels of PTSD in these populations, we can see trauma exposure as a major element of this. Of course, this displacement and those other stress factors do play a really important role in it, but the reason they're being displaced is due to some of these other trauma exposures, such as intentional trauma. So sometimes this can look like torture, threatening circumstances. This includes war conditions and other violence that they might encounter, and a true genuine fear for the loss of their lives, or the struggle to survive. Further, there are other stigmatizing cultural beliefs that restrict their access to employment, housing, education, and healthcare. So often these individuals are living in poverty, and this can be another factor that um, may influence their development of PTSD. Um, Complex trauma challenges. So, uh, as I discussed here, we have this intentional trauma element and also threatening circumstances faced due to war and conflict within their countries. Um, so we see trauma from war, displacement, and resettlement, and this complicates mental health assessment. So when we're seeing multiple triggers and potential reasons for the development of PTSD, this can complicate how professionals are able to assess the individual and treat the individual. Further, in particular for these individuals, more training is necessary. So often there's limited training in this trauma-informed care, which can lead to misunderstanding and then therefore um, misunderstandings in the diagnosis. So misdiagnosis and then ineffective treatment. Okay, stressors affecting refugees. So we mentioned a few already, but we saw violence, we see harmful living conditions, poverty, instability, separation from family, and their country and like a lot of loss as a result of this. So we also see like acculturative stressors. So we see isolation, familial separation, and other challenges of acculturation within the host countries. Um, these stressful exposures do not always lead to PTSD, but are necessary for its development. So this is adding another piece or component into why we see heightened levels of PTSD within this population. Okay, dehumanization of refugees. So we often see that refugees struggle with culturative stress when coming into a country. This can be due to poverty, um, inaccessi inaccessibility to certain healthcare services, certain services that will help these individuals create a stable life for themselves in their new host country. Um, but we also see a lot of prejudice and discrimination against these individuals. There's some narratives of that individuals are getting ahead, are failing to uphold moral values, willing to break the law, and this belief that they're violating basic principles of fairness in order to benefit themselves, when in reality, these individuals are victims and survivors of war and conflict and or persecution. So a lot of these narratives are genuinely hurtful and um, misunderstandings that do then affect these individuals. And so often they have this fear of persecution, fear of prejudice and discrimination. So this can also come up as a component to consider within clinical settings. So it's really important for therapists to be counteracting these dehumanizing stereotypes about refugees. Further, there's factors worsening refugee mental health. So pre-migration, we see the torture, family separation, and that all of that cumulative trauma. And then post-migration, we see stressful asylum processes, um, prolonged detention. So often there can be a lot of difficulty even once they've left the country. Um, and so there's like that lack of security. So also insecure immigration status and poor access to services is another really major component. There's limitations to work, education, and opportunities in host countries often. Barriers to care in the context of refugees. So we see limited transcultural knowledge within clinical professionals, also lack of knowledge. Within the refugees, there's a lack of knowledge of these available resources. So even when these resources do exist, it's there's a lack of knowledge within these populations about how to access them and how to receive these services. Further, is systematic time constraints, familial obligations. These individuals are often having to work and make a living, so that can often contribute to some of the difficulties that they face. Another difficulty that they face is difficulties with language and communication. Often these people are coming to countries that speak different languages than their home country. Um, and then further stigma, they have this stigma associated with mental health problems and the use of services, which often acts as a major barrier to care. Yeah. So benefits of this of a transcultural approach. So considering the factors that I've discussed in within barriers to care, um, and these certain cultural considerations which help us to understand why refugees may be um, opposed or mis distrusting of care services due to due to prejudice and discrimination. Um, we see that a transcultural approach is more effective in treating these individuals. So, having an informed social cultural assessment to improve screening and care plans. So, back to that point of misdiagnosis, um, really understanding what's happening in all of the cultural aspects and elements that are affecting these individuals um, can lead to improved diagnosis and therefore better treatment of these individuals. Um, yes, leading to culturally appropriate and effective care for immigrant and refugee families. Further, we see some other clinical considerations. So, um, for example, we see a lot of Afghan refugees in certain countries, as they are one of the biggest countries that we see refugees uh, fleeing from. Um, so, within treating like a specific population, it would be important for the clinician to understand and prepare for those clients. So, not just going in with the knowledge that they have about psychology and PTSD, but also understanding the experience and the lived experience of those individuals. Um, with all of the factors that I've uh, demonstrated or discussed, but like taking it a step further and seeing what are the specific challenges that Afghan refugees face themselves. So, this cultural education and also kind of cultural sensitive care. So, understanding and not judging aspects of their culture, but really understanding further aspects of their culture to integrate that into the way that trauma or therapy is provided. Um, Language, making sure that someone can adequately translate for these individuals is very important. Establishing this trust. So we see with prejudice and discrimination, this mistrust of healthcare professionals and medical professionals in general. So establishing that client-patient rapport, client-therapist rapport is really important. um, Considering that these individuals may have specific needs due to their specific condition um, and life circumstances. I've heard that, or I read that uh, incorporating family and establishing trust within family is really important aspect of that, and understanding that family is a important aspect of these individuals' lives and something that either they're feeling a lot of loss within. So, as an example, understanding that and not glazing over that. Further understanding their traumas and like the systems that they live within. That's it. Thank you.